This is our speaker, Alex Berry.
Good morning. It's, I guess, always the standard when you begin these kind of. Come on, don't be shy. No, it's no. When you begin these kind of presentations to sort of introduce yourself, and what you're doing, I think, is establishing the argument of authority, right? Oh, I have so much background, and this is where I've studied, and blah blah. So it makes it sound important. What you're going to say has some relevance. That's the standard. But I think more important, particularly for a talk like this, where we're going to start with an issue of spirituality in Chinese medicine. More important is to understand something about the nature of the lecturer than some background. And we'll get to my background in a minute. But I think it's important with all presentations, particularly in an art like Chinese medicine, to realize that the teacher can never tell you something that's true. They can only tell you their own delusions about how things are. And then you have to see how that harmonizes with your worldview and what might be useful about their delusional view. This was particularly driven home to me some years ago. I was in the Jade Buddha Temple in Shanghai, maybe 25 years ago or so, and I was looking. They have, back in the Cultural Revolution, they were destroying a lot of the temples, but Zhou Enlai, the premier of China at that time, had some troops at his disposal and managed to dispatch them to what he thought were very culturally relevant sites to sort of protect them from the Red Guard. So Mao was doing his thing, struggling with others in the government, releasing the Red Guard, and Zhou Enlai was sort of in the background. Oh, I can protect this and I can protect that. And one of the things he protected was the Jade Buddha Temple in Shanghai. I think, we can wonder his motives, but maybe because he thought it would be a good tourist site later, which in fact it turned out to be. But it had one of the few places that has a complete collection of the Buddha Sutras. And so I was in the sutra room there, and it's, a big wall of old texts, and I'm sort of looking at it and just sort of in wonder. It's such an interesting display in a way. And this old monk came in, and he was kind of surprised because to see a foreigner in there wasn't so common 25 years ago or so. And so he said something to me which I didn't understand. And I had a Chinese friend around. I got him to see if he could get what he was saying, and he didn't get it either. Turns out he was speaking some very minor dialect. He had been in the monastery since childhood, never learned to speak Mandarin, the kind of common dialect. And so we had to get another monk in there who could speak that dialect to so we were going through these stages of translation. It turns out what he was saying to me as he pointed to all this stuff was, it's all lies. And so then, of course, this had to engender a discussion. And the point came that there was no true spiritual teaching. In fact, what spiritual teachings were ways to balance people's misapprehension that was causing them some kind of discomfort, some kind of suffering, was preventing them from really fully realizing themselves. And so all the teachings were ways, and I thought this is exactly what Chinese medicine is, right? We don't say there is a correct treatment. The correct treatment is the one that balances the person's condition. Some people have a more cold yin condition, therefore they need yang tonification. It's going to be a totally different treatment than the person with heat, right? And it's the same way with spiritual teaching in that Buddhist tradition. You're saying something not because it's true, but because it balances the person's difficulty in some way. So this then there is the Buddha saying that's, I think, kind of relevant to that these teachings are therefore more true than facts. They're not basic facts. They're something useful and so as I go to present, I have my things that make my life and my perspective, and those things are more true than facts for me, but they may or may not be for you. You have to, because I'm basically a clinician. So you have to see, how are these things relevant to the way you like to interact with your patients? How are they useful to you in them balancing your patient's condition to help them actualize themselves? So, as I say, as we begin this, it's important to get a sense of who that teacher is. And I think you can learn that a lot from just observing them. I taught a seminar, and it's a story. It's once in a while you have those life events that are great because they're kind of a feeling or a story that sticks with you. And I just had the good fortune a couple of years ago. I was teaching in Denmark at the first Scandinavian acupuncture congress, and they did something unusual. Whereas most of these larger congress have a time in the morning where all the speakers come and present for 45 minutes or an hour about their topic, and then later they'll do a much longer presentation. That's sort of the standard. But at this congress they said, no, we're not doing that. We want all the speakers to come at once. Oh, and by the way, when we have those morning things where we have to speak for an hour, I always avoid them because I go and do my hour and I don't come and hear anybody before me. I don't stay and hear anybody after me, because if I do that, I end up presenting my reaction to what they said. Because I'm very much a stream of consciousness lecturer. What's on my mind really biases my presentation. So if I come and I listen to an hour of somebody's talk before me, I start, but this Congress, they said, no, all the speakers have to come. They sat us all in the front row, and each person only got 10 minutes to speak about their topic. So what can you do in 10 minutes? Well, what each speaker did was get up and say what they're going to talk about later. I mean, how boring can that be? So each speaker standing up 10 minutes, I'm going to talk about this and this aspect later. Sit down. Well, I was sort of in the middle of the group. So, 3 or 4 speakers went before me. And what I was, I was sitting on, here he goes. He's telling what he's going to talk about. What should I do? What should I do for 10 minutes? Because I don't want to do that same thing. So I started to notice that some people, would stand still behind the lectern. Other people would step out in front of the lectern. Some people waved their arms. So I thought, I should point this out to the group. So I get up and I said, well, I'm not going to tell you what I'm going to talk about later. Instead, I'm going to invite you to try to diagnose me. Everybody studied visual diagnosis. You can see how I am. I'm up here waving my arms. I can't stand behind anything. I mean, they gave me a mic this morning. I'm like, you have to hold that hand still. It's impossible for me. You get a sense of my nature. So I said, I invite you to do the same thing now as the rest of the speakers go. Try to diagnose them. See who they are. Don't listen to what they say. After all, they're all just going to tell you what they're going to talk about later. So instead, you should be doing diagnosis. See who this person really is. And so then the rest of the people had to get up and do their 10 minutes. And of course, they're all very experienced speakers, lecture a lot. But they'd get up and you could see somehow they were apprehensive. And in fact, one of the speakers, he was like, after Alex said that, I don't know where to stand now. Right? I disrupted their sort of internal state somehow they became very self-conscious. Right? But what was the audience, what did I invite the audience to do? Read who that person is. So it's a kind of a very important question. What internal state got disrupted in those speakers? Very relevant to our talk of spirituality. The Chinese actually have an important name for this internal state. It's called Ding Li. Li, this word Li is power or force. The Ding Li is the central force in the body that allows for stability. They say it's the force when all the internal dialogue of your mind has ceased. That's an interesting statement. When you cease your internal dialogue, then you have the most Ding Li, the most central force of the body. Of course, if we want to be clinical about this, it actually is the Chong Mai. It's filled with blood. It's connecting the kidney to the heart. It goes through the spleen. The spleen is very central. So in fact, in some ways, we say that the spleen regulates the Ding Li because it's the central force. We often talk about, are you grounded? You see this happen. Heat goes up the Ding Li when you get really nervous. And so your voice starts to get higher, right? You start to sweat on the palms and so, that's actually pericardium related. Because the heart produces sweat, right? And as the heart produces sweat, when it's conducted out, like to the palms especially, it's coming out to the pericardium meridian. So people with sweaty palms, you usually have to regulate the pericardium meridian. It's the connection of the heart physically outward. So that's a sign that that Ding Li has heat is going up because I'm nervous. So we can tell you when we're going to treat the Chong Mai to help anxiety, because it's going to bring that back down, right? So to understand this Ding Li a little bit better, there's a famous teaching story about it. It comes from our Qigong tradition. There was the Tai Chi master, and when you practice Tai Chi, there's a form called push hands, right, where you're actually trying to unbalance a partner. And there was a famous Tai Chi teacher, and he had a long-term student, and at some point during the push hands practice, the student began to be able to push this teacher. And he couldn't even unbalance him all the time. And the student became quite proud of his elevated ability now. And so he said to the teacher, I think I now have mastered this skill. I think I don't need to study with you anymore. And the teacher just sort of laughed and said, oh, is that so? Well, let's test that theory. Let's go for a walk. And they go walking in the woods, and they walk for a long time, and the student is like, what are we doing? And finally they come to the edge of a cliff. And the teacher said, okay, now let's do push hands right here on the edge of the cliff. And suddenly the student was unable to maintain his balance. He was so afraid, so distracted by the edge of the cliff. And the teacher said, oh, see, your ability is at a very low level. In the classroom, stability, no problem. Now, in this kind of environment, your Ding Li, that central axis of the body, connecting, we often talk about in our clinical diagnosis, disconnection between heart and kidney. How does that disconnect happen? It's this disconnect of the Ding Li, that central force, is the issue. So this is very relevant to our discussion of what is spirituality. One thing we want to do in a patient is always reestablish their Ding Li, their central force that connects heart and kidney. We'll see later as we talk about Yangsheng, nurturing life. And two of the issues we're going to talk about are breast disorders, prostate. They're all relative to this. It's really that central pathway that's disrupted. I think this is why you often see in modern society problems in those areas, because our modern society doesn't cultivate Ding Li very well, because people are so unclear about their place, about their direction, about their it wasn't that long ago that even here in the West we had a more traditional society in that roles were well defined. When you feel comfortable in your role, the Ding Li is cultivated. When you feel insecure about your choices, the Ding Li is disrupted. And this is what modern society, we see it struggle with our patients a lot. Right? They come in and, now we go a little bit to some background, but my clinical practice for a long time was extensively pediatrics. And I see this all the time in pediatric practice, that people don't know what to do with their kids. They don't know what to do with parenting and family life and all that. They're trying to figure it out. I had an old Korean mentor. That was my beginning in Chinese medicine. And when he came to the States with me and started to see patients here, he was always like, this is so strange, you Americans have no grandparents. And I'm like, what do you mean we have no grandparents? He said, well, people are coming and asking me questions they would never ask me in Korea, like, what should I eat when I'm pregnant? Don't come and ask me, the practitioner. Ask your grandmother. She knows that. And she knows to cook chicken or fish soup with kombu and sanchi in it once you give birth, and to give you that for at least 3 to 5 days. And she knows those things. That's her job. You don't need to come to a practitioner for, well, you sure do here. And then, what about all these other issues? As I was driving in, I saw a billboard. I live up in Asheville now, and I was driving down, and I saw a billboard. Breastfeeding is best for both the mother and child. They had to put that on a billboard? Like, I mean, what kind of culture is it that wonders, that needs to be informed that that's true? Our culture. And so this is the situation that we're encountering in the clinic. So people's Ding Li is really disrupted. There's that debate going on now about how long to breastfeed. You've been following that. I mean, some people 4 years, some people even saying 6 years. Oh my goodness. You know, you want to talk about a blood deficient mother. I want to see one who's been breastfeeding for 6 years. You know, and then she's supposed to have enough resources to take care and attention to the child. That's going to be very unusual, isn't it? So if we're in a culture, an environment that creates this kind of questioning, I mean, how many of your patients come in struggling with what to eat for themselves? Because no matter what they choose, guaranteed there's someone who says that's the wrong choice. Should I eat a raw foods diet? Should I eat more whole grains? Should I eat just protein? So many. Ask your grandparents what they should eat. Normal food, right? That they would just shrug it. It wasn't, I know my grandmother, I remember as a child, I mean, I think my grandmother was a Taoist, even though she was an Italian woman who came from Italy, you know, because if you look at Taoist recommendations for living, which we're going to get to in our lecture, you know, my grandmother, she was always dressed in what I thought as a child was the same dress. And I said to her, Grandma, why do you always wear the same dress? She says, what do you mean the same dress? She actually had just a bunch of dresses of the same style. She goes, because I like that dress. It wasn't like a big choice. But as you have to make decisions, remember, part of bringing your personality out, again, something so important in our pediatrics practice, bringing your personality out requires the kidney yan to move up through the central channel. On the way, it activates the gallbladder. And the gallbladder helps to conduct your personality outward. We often see this. People with phlegm obstructing the gallbladder and the daimon can't bring their personality out. How often do we see it with children? Kids are by nature little snot balls, right? They come to your practice, they're wiping their nose on the carpet. You think you have snails. What is that, right? Right? So they have all that phlegm, and yet, by nature, they haven't grown into their yin and blood yet. You don't have your full complement of yin and blood till you reach full height. This is why a woman, even if she, in theory, is fertile, she's gone through puberty, she shouldn't yet conceive a child till she reached full height. Then she'll have the maximum amount of blood and yin to give to the child. So yes, a girl 13, a girl these days 10 could potentially become pregnant. Is it a good idea? Absolutely not, because she doesn't have the resources yet to really nurture the child. But once she's reached full height, she has her full complement of blood and yin. So, by the way, we're going to talk about cycles of life in a minute, but just to looking out at the audience, I know this will strike a chord with some. You're at your best from the time you reach full height, which for most of us is late teens. Some people even, it's 20, 21 before they've reached their full height. But from that until either age 35 or 40, that's the best time of your life. That's when you have the optimum amount of blood and yin. For you women, it's 35 you go over the hill. For us men, it's not till 40. We got a little reprieve. But don't worry, I went over the hill a long time ago. You know, I'm almost in old age now, which, remember, women are developing in cycles of 7 years, men in cycles of 8. The reason for that is that women are primarily yin. Therefore, their yang is what's driving the aging process because they have relatively less of it. That's why they go faster. So if you wonder why women who live longer cycle faster through the different stages of life, I mean, you only have to go to a middle school to see this, right? You look at the 14-year-old girls, and they're all developed and putting on makeup, and you know, and then the boys at that same age are like looking at the girls and throwing like spitballs at them because they're like totally underdeveloped in comparison because the boys are primarily yang. Therefore, it's their yin that drives the aging process. And so they age slower. They develop in cycles of 8. So a 16-year-old boy and a 14-year-old girl are on the same level. By that time, you're 2 years behind already if you're a boy. So therefore, we men don't go over the hill till age 40, whereas it's 5 times your cycle. So in the case of women, 5 times 7 is 35. You've reached your peak. In the case of men, it's 5 times 8. Now, if if that's true, if you go over the hill at 35, what does that say to us in our clinical setting when all these women come in 35 and older and want to have their first child at that time? They're already over the hill in terms of full complement of blood and yin. Therefore, you better treat them. See, this is the second aspect of my delusional nature. I don't want to tell anybody what to do. That's my nature as a practitioner. Because it comes from the fact I don't like to be told what to do. Given that, I don't want to make judgments. Now, this may not harmonize with you. You may be a clinician who loves to tell people what to do. I had this experience some years ago, geez, more than 30, about 30 years ago now. I had a clinic in Boston back then, and my partner was a Swiss fellow. And he was very Swiss in nature, in that he was the kind of guy that put up lists around the clinic of how you should behave. You should do this at this place as far as processing. Back then, we reused the needles. You had to autoclave them and stuff, And so there was the list on how to run the autoclave and how to process the needles. There was the list on how to do the filing. That was just what made him comfortable, right? That was his nature. And I'm Mr. Anti-list, like lists drive me crazy. But we were good friends anyway and worked well together, except when we had to take over each other's patients. Because he'd be gone, I'd see his patients, or I'd go somewhere, he'd see my patients. That's always one of the nice things of a group practice. But what would happen? I'd go away. Well, first, he'd go away, I'd see his patients. He'd come back, his patients would tell him, "Oh, Alex, nice guy, didn't do anything." I'd go away, he'd see my patients, I'd come back. My patients would say to me, "How could you leave me with that guy? He was so pushy. Oh, he was terrible." This is the reality of clinical practice, isn't it? So my way is not to... So if a woman comes to me and she's 40 and hasn't had a kid and wants to have one, what can I do to support her? It's not for me to judge. But I can know that she is already past the age where the full complement of blood and yin is present, and I better support that in some way, so that that baby gets the maximum benefit in its development. Right? I can understand the process. So I always see that as my role, to help people understand how their choices are influenced by the outer circumstance, and what can we do about it? Like I say, our society has a lot of argumentation about the right choice. Should you vaccinate your kids or not? Well, the truth comes in. It depends on your viewpoint. If you take the view from general public health, even if every possible bad thing they say about vaccinations is true, like causes autoimmune disorders, weakens the immune system, maybe is the cause of autism, maybe all those things are true. Doesn't matter. If you're looking from general public health, vaccinate everybody. Because the negative consequences in terms of autism stuff are still less than the economic and social consequences of big epidemics of these childhood disorders. But if we look from the individual perspective, it's a totally different, especially if you look from the individual perspective in a generally vaccinated population. You shouldn't vaccinate your kids. No reason to. It's crazy to. This is why if you do an anonymous